Hello everybody, I'm Greg Stock. I'm the CEO of Thibodaux Regional Health System. It's a pleasure today to introduce Dr. Giambelluca. She's an orthopedic surgeon with a fellowship in foot and ankle surgery and treatment of the foot and ankles. And she's a new member of the medical staff at Thibodaux Regional, finished her training not long ago, and we're really pleased to have her in this community in this area.
Yes, thank you. I'm excited to be here. I'm originally from New Orleans. I did most of my training here in South Louisiana. I did my medical school at LSU in New Orleans and then completed my orthopedic surgery residency at Ochsner.
Yeah.
This last year, I did a foot and ankle fellowship at Duke University in Durham, North Carolina.
Awesome.
So that was kind of a one-year subspecialty training, learned from some pioneers in
Duke
foot and
is
ankle.
a very reputable place, great training program.
I saw a very broad range of foot and ankle conditions, patients, pathology, and was able to train with 8 different surgeons there. So everyone kind of does things a little different. Overall, it was a great experience.
It's awesome.
Yes.
You're training all the way through, though. LSU's good, too. So, yeah, well-trained and very highly recommended.
My specialty is really foot and ankle surgery. So a very wide range of patients and pathology ranging from acute conditions such as fractures, sports injuries. I also did an extensive amount of training in foot deformity such as bunions, hammer toes, and degenerative chronic conditions, so arthritis of the foot and ankle.
The age range in that is pretty broad, right? I mean, it can be a young athlete that's playing whatever sport, soccer,
Yes.
football, whatever it may be, have an ankle. Those are pretty common injuries sometimes, those. Yeah, in between is that middle-aged group that still think they can really play, but it's mostly up here. And they end up hurting their ankles or foot, something,
Unfortunately. I might fall in that range soon, but unfortunately I see.
The tennis players and so on. Yeah, and then, of course, it's an aging population and things happen to people over time, old injuries even. There's pain involved with that. There's some things that are, if people are still working and stuff, for example, they try to go to work and they can't stand on their feet too well or very long. A lot of those kind of things. But you can also diminish that, right? Help the pain and it's not always a surgery that you do, so you're very capable of doing it.
Yes, and definitely, non-operative and operative treatment are definitely both things that, when you come to see me, most of my patients probably can tell you, I definitely like to, let's go through all of the non-operative things and avoid surgery unless we need it. But there's always options down the road, and there's definitely a process. And the goal is to hopefully get patients better without surgery, but there's options if needed.
Fantastic. We love having you here. Thank you for your time today. Dr. Giambelluca, Thibodaux Regional Health System, thank you so much.
Thank you.